Okay, folks. So we're going to start off by doing the first part of the health course, which is heart disease. And really, before we get into that, there's a couple of things that I want to cover with you, just so you can understand what it is you're going to have to do. So you might be thinking, I picked geography. Why on earth are we studying health? Remember, we did a wee bit of HIV/AIDS. For those of you that got the chance to in S2, geography is really, really important for health. Loads of people who go off to university to do geography end up actually getting a job in health with the NHS, working for a charity abroad, and really it plays a huge role in making policy to do with public health, health of a population in a certain country or a certain area. We need to understand disease risk factors and how risks like genetics, lifestyle, environment, and occupation all interact with each other in the social, built, and natural environments. And those are perfect conditions for a geographer to study. Geographers are also really, really important because we help map out and monitor the spread of the disease. And if you are to look on any map about COVID-19, it'll be a geographer that has produced it or produced the software to create that map. So it is really, really important. So health is part of the global issues section of geography. We're going to look at 3 diseases as part of the National Geography course. So the first one is heart disease, which primarily affects developed countries, for example, the UK, the USA, Germany is another example, Japan, and so on. We're going to look later on at malaria, and that usually affects developing countries, so poorer countries, Nigeria, Uganda. And we're going to look at HIV and AIDS, and that's a disease that affects countries all around the world. And when we look at that, we're going to look at the different reasons as to why that is. So, for the health section, the global issues section altogether is worth 20 marks. So you get 10 marks for climate change and you get 10 marks for health. Okay, so really nice and easy. So the 10 markers are usually then divided up into 4 and 6 marks. And what we're going to be doing on for this first wee part of the presentation is focusing on the nice, easy 4-mark question. Now, I'm saying this, it is usually a described question, and it can ask you about any disease. So please don't panic, right? Because some schools study cancer, but we look at heart disease. You could be asked about anything. They could give you a graph or a map showing different blood types around the world, and you would still be able to get 4 marks. So please don't panic. They're really, really easy to do, and it's like 3 marks from the SQA. They're so, so simple. So I'm going to show you some examples from the SQA in the past. So this is the one from 2015, and this is actually very apt for us right now. So it's worldwide male deaths from heart disease in 2011, and it's per 100,000 males. Now, if we look at this, what this means is we need to use this section up here, per 100,000 males. That's part of the question here. And we've got a graph here, a key on the side showing us how many people are dying. And this was in 2011. So obviously this colour here, the black, that tells us that 444 to 841 people are dying per 100,000 from heart disease. You could use an example, Russia up here. So let's look at the question. It says, describe in detail the distribution of male deaths from heart disease, and it's worth 4 marks. So if it says data not available, don't ever use that because you're never going to get a mark. So you need to tell me where heart disease is most common. Okay, where the deaths from heart disease is most common. So you might want to say, in Russia, there are 444 to 841 deaths per 100,000 as a result of heart disease. Tick. So start having a look at maps, start having a look at countries that you can pick out quite easily. Some of the ones that I like to look at are Canada, the USA, Mexico, Brazil, Chile, Argentina, Madagascar, India, China, Russia, Australia, New Zealand. Then you've got all the European countries, you've got Iceland, the UK, Spain, France, Germany, and so on. So try to get used to naming some of these countries because it will help you when you're doing this type of question. The 2016 question was actually a graph. So it says this is Ebola cases in selected African countries from April to October 2014. So all that this question is asking us to do is to describe in detail the changes in Ebola cases in the 3 African countries. So you must talk about all 3 countries to get full marks. Literally, all you have to do is say, let's have a look at this dotted line here for Liberia. So you could say, in the middle of June, the cases of Liberia rose, the cases of Ebola in Liberia rose from 0, and on the 1st of June, they were approximately 50. By the middle of August, they had risen to 500. By the 1st of September, they were just below 1,000. And just after the 1st of October, they were over 2,000. So I've already got quite a few marks in there. But I need to talk about Sierra Leone and Guinea as well. So we have to think about the easiest way to get 4 marks, because every change that you mention would get you 1 mark. Question from 2017 was describe in detail the changes in death rates from malaria. Again, a really nice, easy question. So where there is no change, so it says no malaria transmission. If you mention any of those white countries, you're not going to get a mark. So we have to focus on areas where we've got a decrease or an increase. And what you can do is you're starting to look at this and start to panic and go, oh my goodness, I don't know any of these countries. This is quite difficult. I know Australia, I know New Zealand, but I don't really know a couple of the other ones. Don't panic. Use regions. Okay, you could say the southern part of Africa, the northern part of Africa, Central Africa. Okay, you could say the south of South America and things like that, and that can help you pick up the marks. So you might want to say things like, in India, there has been a decrease in 0 to 49% of malaria transmission. We could say there has been a decrease in Brazil of less than 75%. Okay, so try and make it as easy for yourself as possible. We've then got one about adult HIV infection rate by country in 2013. So describe in detail the global distribution of HIV and AIDS infection amongst adults. So you might want to say that, for example, the majority of HIV infection rates are in developing countries, and that would get you a mark. You could then maybe say, for example, in South Africa, this part here, more than 10% of the population have got HIV and AIDS, and that would get you a mark as well. The UK is much lower, less than 1% of our population are living with HIV, and that would get you another mark. I wouldn't then get a mark for saying in the USA there is also less than 1%, because you've already mentioned the 1%. So try and go for a country that's 1 to 5 or 6 to 10 to get those extra marks. And this was the one from 2019. Describe in detail child mortality rates across the world. Again, try and use one from each colour to make sure that you're going to get the full mark. So a really nice, easy question there. So, if we were to look at the 2019 question, this is about infant mortality rates. Here is the model answer. This is how simple it is from the SQA. Infant mortality rate is highest in developing countries. Let's go back and have a look. So developing countries, absolutely. These poorer countries in Africa, parts of Asia, yep, the rates are much higher. Okay, we're in the dots into the shaded parts. Europe, North America and Australia have the lowest rates of child mortality numbers of between 1 and 25 per 1,000 children. So let's go back to Europe. Yep, Europe's here. Very low infant mortality rates. Okay, so this is the number of children that die per 1,000 children that are born. The next one is most of South America has child mortality rates between 1 and 25. There's a wee R here because that's a repeat. We've already mentioned that up here, so we won't get a mark from that. Apart from Bolivia, which is the greatest rate at 51 to 75. So we've got Bolivia in here who's got that high rate. Nigeria, Ghana and Mali have the highest rates of between 101 and 300. Again, if you look at this part of the map here, that's correct. And then Algeria is the kind of exception in Africa. So they've got a rate of 26 to 50. And if you look there, there's Algeria there. and theirs is slightly lower than this part of Africa in there. So actually it's really, really straightforward. So easy peasy, you can do it for any type of question. This question could literally ask you about the number of people who drive pink Volkswagen Beetles, and you could get 4 marks. It could ask you about the average number of bald geography teachers around the world, and you could get 4 marks. And it could get you a wee mark, even something simple as number of geography graduates with a success job. Clearly that's not me because I can't spell successful. I will have to change that in the real PowerPoint. So, a describe question, don't tell me why, tell me what. You don't have to explain why the numbers are the way they are. That would be an explain question. These were all described. You just have to tell me what you see on that map, on that graph. What do you see? That's it. It's so simple. It's really useful to use comparative language. For example, there are more infant deaths here. There is less HIV infection here. The area with the most deaths from heart disease is here. The area with the least amount of malaria transmission is here. And start to become familiar with countries and regions and continents, and that'll make it really, really easy for you to get your 4 marks. Okay? Here's an example that might be used in the next couple of years. Describe in detail the changes of COVID-19 cases for 3 of these countries. Again, you've got a graph here with deaths from COVID-19. And this is something that the SQA might very well ask in the next couple of years, because this is real data. Geographers use real data. Here's another wee fun one. This is the number of McDonald's restaurants per 100,000 people. You should be able to get 4 marks doing that. What could you tell me in the USA? It's 5 to 5.9 restaurants per 100,000 people. In Canada, it's 4 to 4.9 restaurants per 100,000 people. Okay, so it becomes really, really easy and straightforward. So, before we start to study heart disease in a lot of detail, we're going to have to look at health comparisons between developed and developing countries. So if you have a look at this wee table here, we've got life expectancy as an average across developing countries and developed countries. So 1950, the average life expectancy was 41 in developing countries compared to 66 in developed. And by 2010, that was 67 and 78. And they're estimating by 2030 it'll be 72 and 85. So this table shows one of the starkest differences between the worlds of the rich and the poor. Health is much better in the developed world, and people live far longer. If you are born and live your life in Japan, you can expect to live to 84. But if you are born and live in Chad in Africa, your life expectancy is 53. Of all the inequalities in the world, surely this is the worst. It is quite staggering, really. So, there's a wee section here for Introduction to Heart Disease. You're going to have to copy this down, this wee section here, into your notes. And obviously, you can pause this video if you want to do that, or the PowerPoint will be available on Google Classroom. So in developed countries, heart disease is the second biggest cause of death after cancer. In fact, it is the leading cause of death in the UK. It kills nearly half of all men and women. 1 in 4 men will have a heart attack before retirement age, and most teenagers show signs of narrowing of the blood vessels, which is the start of heart disease. Unlike major diseases in developing countries, heart disease is non-infectious. One person cannot infect another. Instead, the causes of heart disease are more complicated. So heart disease is something that's really, really important. I've got heart disease in my family. My grandpa had a heart attack when he was, oh goodness, how old was he? 37, and my dad was 49 when he had a heart attack. Both of them were lucky enough that they survived because of the advances in technology and medicine, which we'll look at later on. But it's something that I have to live with. Like, I'm very conscious that the chances of me having a heart attack are quite high because my dad and my dad's dad have both had heart attacks. So that's something I need to be really careful about. So this is going to be your first question, your first past paper question that I would like you to complete. So this will be due on Friday, and you're going to have to upload it onto Google Classroom. So you can either type it out and upload it in a document. You can just type it straight into the answer box, or you can handwrite it, take a photo of it and submit it. If you're stuck, have a look at the model answer on slide 10. Go back and have a look, and it will give you an example of how to write that answer out. So this is the number of deaths, not the number of people who've got it, but the number of deaths. How many people are dying from heart disease? So you might want to start off by saying, in Russia, between 444 and 841 deaths per 100,000 are the result of heart disease in 2011. Tick, that would get you a mark. So try and get a country for every colour here. Make sure you mention this part up here as well. Okay, so good luck with that. If you're stuck, drop us a wee email, put a wee comment on Google Classroom, and let me know how you got on.